I've been here since Thursday. It's Tuesday. So, they're kicking me out. I'm going home tomorrow. I have polymyalgia rheumatica. I prefer to call that polymyalgia romantica. I mean, you know me. It's an intense inflammation of the muscles. So they have put me on that dreadful, dreadful drug, prednisone. And God knows, and this could be the rest of my life. I can't believe that the results of that fall are going to change the entire rest of my life. I'm having trouble getting my mind around this. The treatment is that you start the prednisone, you take it for 2 weeks. I'm taking 20 milligrams a day. After the pain is completely stopped, which I'm wanting to say it's stopped, because I want to stop this drug. I'm really so afraid of it. I was paralyzed. I couldn't move. I mean, I was paralyzed. It took 2 people to get me out of bed. My hands were they were so painful. I couldn't use my hands to hold a pencil or phone or to help get me up out of a chair or the bed. I couldn't use my arms at all. I had no arms. And every time I needed to get out, it took 2 people. My legs were useless. And my neck. I had the MRI, that was for the neck. I've had many, many tests. After the pain has stopped, then the trick is tapering the prednisone. That means they cut it down by 5 milligrams per day at 2-week intervals. So that after 2 weeks I'll be taking 15 milligrams. It will take 2 or 3 months to get me tapered down. I am going home tomorrow after 2 months. Going home from the hospital in this situation is different than most people go home from the hospital. I'm actually going home from 2 months in India, 2 months in a very bizarre travel experience, I must say. And plus I had sublet my home, which meant I had packed everything away. My computer and everything has been packed away in a storeroom. So going home means unpacking from India. It means setting up my home as I'm used to living in. So I'm getting together a crew of friends and my darling daughters who are all coming to the rescue beautifully. Staff here at the hospital is awesome. Not the doctors. I think we can do without the doctors. But the caregivers, the nurses' aides, are the most devoted, love-giving, caregiving people you can imagine. I was here in Kaiser once before last year having some surgery, and I had the same experience. Most of these women, well, there are men as well, but most of them are from the Philippines. And Komikero, I'm telling them all that I have a friend, Komikero, and who you are and everything, and they're all very impressed. And and you have that same spirit. It's a treasure. We don't really need the doctors. Luisa, where are you from?
Philippines.
Philippines, yes. That's where the queens are all. They're all.
Oh yeah.
You guys are.
No, you're in the city.
Yes, and I love that shirt you're wearing.
Oh, thank you. It's green.
Yeah, it's very
Different,
nice.
Yeah.
And how long did you work here?
7 years.
And what do you like about this job?
Well, as long as you enjoy, although it's hard, you can manage.
Yeah.
That's the technique here. But if you don't like the job, you're not gonna stay here for long.
That's right.
Yeah, as long as you have the heart
Yes.
of the patient.
Yes.
That's the most important.
Yeah.
If there's no heart to the patient,
I know. Well, that's what I keep feeling here is that all of the caregivers
yeah,
are giving love.
yeah.
I hardly ever feel love coming from a doctor. You know, not like it comes from you people. I mean, I'm just so grateful for it. It's been so wonderful.
Well, I just started and
You just came on
oh
duty?
yeah, just came into
Yeah, 'cause you look very fresh and
later on.
ready for a big night. So you work till
You know
11?
what? You feel better now because I can tell that, you know, the way you walk before, remember?
Oh, well, I was like paralyzed. I couldn't move, remember?
Yeah.
It took two people
Oh,
to
is
get...
it on?
Is it on?
I don't know.
Oh. Oh, yeah, it's on.
Oh, it is?
Yeah.
Oh, I don't know. I thought you just talked to me.
It's all quite an adventure. And when I look at some of the people on this floor, some of the patients here, I am so lucky. It's unbelievable. And when I look at even some of my new online friends and what their lives are like, I really have nothing to complain about at all. I'm grateful. I'm feeling energetic. I painted 12 paintings while I was in India. I woke up yesterday or this morning at 2 o'clock and got up and painted a picture because a friend brought me some art supplies here. So, and I'm looking forward to getting started doing the videos. I have my camera here in the hospital room, and I'm going to be back with all of you. I'm looking forward to it.